Okay, good evening, everyone. My name is Dwayne Wharton with the Center for Urban and Racial Equity and the City of Philadelphia Mayor's Commission on African American Males. On behalf of MCAM, the City of Philadelphia Office of Black Male Engagement, and the Center for Urban and Racial Equity, thank you for joining us this evening for the discussion, COVID-19, Black men's physical, mental, and spiritual health. There were limited slots available for participants today, but this webinar is being recorded and it will be shared on our respective websites as well as social media platforms. For those who are with us live, you have the ability to ask questions through the Q&A function, which you see at the bottom of your screen. It will allow attendees to actively participate, so we do encourage you to send your questions to the panelists throughout tonight's discussion, and they will do their best to answer them in written form so that everyone can see them in real time, and they may even incorporate them into their comments. So let's jump into it. So as the world grapples with the COVID-19 pandemic, it has been stated that the virus does not discriminate. However, we see that Black people across the nation are contracting COVID-19 at higher rates and are more likely to die. Joining me tonight to discuss what's behind these numbers, the connection between our physical, mental, and spiritual selves, and what we need to do to keep healthy in this time and beyond are Dr. George James Jr., a licensed marriage and family therapist with the Council for Relationships; Terry Johnson, the manager of community partnerships with Get Healthy Philly, a division of the Philadelphia Health Department; Reverend Leroy Miles, associate pastor of sanctification at Enon Tabernacle Baptist Church; Dr. Raynard Washington, deputy health director for the Mecklenburg County Health Department; and Dr. Roy Wade, assistant professor at the Perelman School of Medicine at the University of Pennsylvania, General Pediatrics Division, and Children's Hospital of Philadelphia. So first, let's lay some foundation for tonight's discussion. The effects of COVID-19 on the health of people of color is still emerging. However, current data suggests a disproportionate burden of illness and death amongst racial and ethnic groups. So we see that 1 million Americans have been infected and 55,000 have lost their lives as of today, April 27th. Data on race and ethnicity is unknown for a quarter of those deceased. Mortality rates for Black Americans is roughly 2.5 times more likely than Latinos, Asians, and whites. And for states that have released the data, Black Americans have represented 13% of the populations, but have suffered 28% of the deaths. So this is a real epidemic for us. And we have some additional challenges as well. So there is evidence and disparities regarding who gets tested and who gets hospitalized. Black men have expressed concerns that wearing masks would make them more vulnerable to police bias. The majority of Black families live in densely populated areas, making social distance more of a challenge. Access to things like grocery stores and medical facilities is more limited for us. There is an overrepresentation in jails, prisons, and detention centers, and those infected with HIV. And our jobs pay more likely lower wages, they lack insurance and paid sick leave, and they put us more in harm's way. And we know that racism, bias, and discrimination pretty much exists everywhere. So while the virus is new to us, the racial disparities in health outcomes are not. In communities across the country, we have been seeing significant gaps in years lived from one community to another. Now that we are in the middle of a public health disaster crisis, the factors that have led to already poor social conditions in health in Black and brown communities are making COVID even more devastating for Black and brown communities. It is said that one zip code is a better predictor of health than genetic code. So in communities where physical and socioeconomic disadvantages, we see early death rates in some neighborhoods. New Orleans, there was already a 25-year difference in years lived across communities, and I'll let you surmise who lives in those communities. During COVID, we also see Black people in Louisiana making up 70% of the deaths in all known coronavirus patients in the state, while representing only about 32% of the population. And I'm here in Philadelphia with a few of my panelists as well, where we see that a quarter of our citizens live in poverty, and that 7 out of 10 adults are overweight and obese, a third of all adults, but 50% of African Americans have hypertension, and 2 out of 10 adults have diabetes, with Black people being 80% more likely to suffer from diabetes. And these factors, along with many other things, contribute to the already 20-year difference in years lived between some neighborhoods. So in Philadelphia, where Black people make up 44% of the population, we're making up 54% of the COVID-19 deaths. Yet it's being reported that those living in higher zip codes have been tested for COVID-19 at a rate 6 times greater than those in poor areas. It's a real crisis. So joining me is Dr. Raynard Washington. And we'll just jump right in with a question for you. So for many of us, the higher infection and death rates related to COVID-19 were not surprising. In fact, they were expected. For many others, COVID-19 has exposed these deep and chronic social wounds in U.S. communities, but there are still some who need clarity on how did we get here. So given your role as an epidemiologist, help us understand why health outcomes in COVID-19 are worse in the African American community.
Yeah, sure. So thanks for having me tonight. The first thing is I just want to reemphasize that there's no real evidence right now that the fact that the African American community is getting hit harder by COVID-19 is due to differences in genetic susceptibility. It really is driven by other factors in our community that have existed long before COVID-19 came. I'll highlight 3 areas where I think are really significant factors driving the disparity, some of which you've already touched on. The first of those is that undoubtedly African Americans have higher rates and earlier onset of underlying chronic health conditions that make COVID-19 much more severe. It makes you more likely to have symptoms. It makes those conditions, things like heart disease, hypertension, diabetes, which we all know these disparities have existed for a long time. And those disparities are a number of factors and that disproportionately impact Black communities for a lot of reasons, from access to care, other health resources, access to social economic opportunity, access to things that make living a healthier life easier. And so those factors have been here for quite some time. And what happens in the era of an infectious disease pandemic or the spread of an infectious illness, and not just COVID-19, you can think about other infectious illnesses where we have differences in rates that impact our community because of these other vulnerabilities. But specific to the respiratory virus, COVID-19, those conditions exacerbate the complications associated with it. And so because of current testing guidelines that really are driving individuals with symptoms to be tested, if you are already sicker, you're more likely to have symptoms related to COVID-19 and makes you more likely to be tested. And also you're more likely to need additional acute care services. So you're more likely to go to the hospital if you have underlying chronic illness and then you catch a respiratory virus, you're more likely to be sicker. And so that's really driving up the underlying chronic illness is certainly driving, or disparities underlying chronic illness are driving it. Another important factor about us as African Americans, that a number of us work in essential jobs. We make up a large share of employment of jobs that are still working with under stay-at-home orders. And some of these jobs are in the healthcare setting, but others of them are in other services like food service and hospitality industry and transportation. And having a large number of us in those settings that really make social distancing difficult to do, and we can't stay at home because our services are essential, does certainly have an impact on communities that are disproportionately represented in those industries. Those individuals who work as essential workers in some of those jobs, like at restaurants and grocery stores, also tend to be lower income. Or even that work in nursing homes or long-term care facilities as medical assistants or any job. long-term care facility that still has to go to work, they're paid hourly, and they're more likely to feel the financial strain of not being able to go to work or missing days of work because of sick leave. And again, this problem was before we even got to COVID-19. That's been the case. The last thing I'll say around this is that we are all aware of the inadequate and the disparities that exist in access to healthcare and other resources for low-income communities, especially those that are disproportionately communities of color. And it's not just the African-American communities, it's really communities of color that are experiencing social economic disadvantage more broadly. And these long-standing gaps in access to healthcare, both in terms of, and other types of resources, really only further are spotlighted when we have a pandemic like this one.
Yeah.
Impact a person's ability to, it's one thing to tell folks if you feel sick to call your doctor, but if you don't have a primary care doctor, how are you going to call your doctor? So certainly having those inequities in access to care and affordability of care. I noticed there was their new sort of at-home COVID-19 tests that have a price tag over $100. If you can't afford food on the table, or you can't afford to do other things that are life necessities, that's just not accessible to you. And so I think those disparities and lack of access to those are just further driving the inequities we see, both in terms of severity of illness as well as overall spread in our community. One other factor related to sort of the social economic disadvantage, and I'll close with this, is this whole notion of density. People of color are more likely to live in areas that are more densely populated. And that's just driven by years of a lot of factors that I don't have time to go into, but we are all aware of the segregation that still exists in our country, and population density in large cities really do drive and have a huge impact on the spread of any kind of infectious illness in communities. So,
yeah, thank you for that. And you can stay connected to this question, but I want to direct this to Terry Johnson, who is working with our health department here. But also, you have a background in journalism, if I'm correct, right?
Right, that's correct.
Right, and you're the OG of the panel as well. So help shed some light on kind of the historical perspective on kind of the conditions that got us here. And there's been this debate, particularly in the past week, that I think Dan Jones elevated in an op-ed where he, at the same time, called out racism and structural racism, but also pointed to Black people must change their lifestyle choices. So this whole tension around personal choice and accountability and historic and structural barriers and racism is real. Tell us your thoughts on this, team, that you've been here for some time and have seen some things.
Right. Well, I think in the African-American community, we've long had this sort of running debate, within the race, but it's also spilled into the rest of the society about where we go from here. And also the debate in fundamental ways gets at the question of democracy in our society. How will we build a society in which all people can live to their fullest potential? And I think even with this COVID virus, we're back at that question. What must we do so that everyone has an opportunity to be healthy? Everyone has the opportunity to work. And the question now, though, really becomes this, and it's a question that's really outside of the electoral political arena, and it really falls clearly into the hands of Blacks, Latinos, and women. How do we build movements to change this society in deep and fundamental ways? Some time ago, I might have thought that that was a ridiculous question to ask. But even when you look at this past presidential primary, there were some questions that went at the heart of who we are as a society. And I think that those questions still remain on the table. How do we begin to build from here? What must we do? I remember reading years ago this piece by Martin Luther King, and he said, the nettlesome question for Black folks is how do we begin to organize to impact the levers of power in this country? And I think we still have to do that. And we have to do that by relying on the imagination and creativity, primarily of young people, to begin to show us a way, show us a path forward.
Okay, appreciate that. Thank you. So Dr. Wade, we've been hearing about the stress that this is causing on the healthcare system, and you're working in hospitals. Can you just share, what you're seeing, particularly as it relates to Black men? And I also have a follow-up question just based on some of the research that you're doing.
Well, so I'm a pediatrician, and we've been fortunate at Children's Hospital that this has been, not necessarily a condition that impacts kids predominantly. Although what we're seeing across the different healthcare systems are an overloading and an overburdening of the healthcare system as a result of the increase, patients who are coming in who are COVID positive, who are requiring, higher levels of ICU care. And we know that, particularly in a place like Philadelphia that serves a majority minority population, that's going to, bring on and potentially magnify disparities. Because not only are you having to deal with the patients who are coming in for COVID illnesses, there are also the typical patients who are coming in for all the other conditions that we would have been serving for now. And so our hospital systems are largely, particularly on the adult side, beginning to bust at the seams. And we know that this social distancing policy has been largely designed to flatten that curve to try to decrease that. But nonetheless, our systems are still stressed.
Yeah, we appreciate that. Yeah, but you also work as a clinical researcher, and I know you focus on the intersection between poverty, adversity, and childhood well-being. So, we're all experiencing some form of stress related to COVID. And, I just really want to hear from you, some of the things that we might be expecting in terms of our health outcomes as a result.
So as you said before, my work largely focuses on how stress, particularly stress experienced as a child, can lead to suboptimal health outcomes across the life course. We know, and we've already heard some of your panelists talk about this, that this pandemic is leading to higher levels of stress across our country and across the world. But there's, that's in particular a concern for communities of color that already exist among stressful situations. And so we know the social distancing practices that have to occur to try to flatten out that curve lead to isolation. Isolation leads to a loss of access to the physical, emotional, and material supports that we all need for survival. That in and of itself can create anxiety and depression amongst families, but also the fear of death can lead to anxiety. The loss of a loved one or sickness of a loved one can further lead to stress and strain in the family. But we also know in communities of color that we are the ones who are more likely to be considered essential staff. So I go to Target every day, or not every day, but periodically to pick up supplies for my home, and it's always minorities who are there working, who can't therefore social distance, and so have that extra stress and strain. We also know that we're more likely to be the individuals who get laid off or lose our job as a result of this pandemic. And as was said before, we already have limited access to healthcare, and so that creates an additional stress when we're thinking about are we potentially being affected by this illness. And so what we know from the adult side is that can lead to that chronic stress, that acute stress superimposed on the chronic stress can lead to a further wear and tear of the body. And so as one of the panelists said before, we are already at increased risk for things like hypertension, cardiovascular disease. But when you add on that stress, that further magnifies our risk for those conditions. We also know that stress can cause an impairment of your immune system functioning, making you less able to respond to infectious conditions. And we know that there are physiologic manifestations of stress. Your stress response system can be altered as a result of this acute stress on your body. So what does that mean? That all sort of further complicates and further magnifies the disparities that communities of colors are already experiencing. And I want to just highlight, I'd be remiss, because I'm a pediatrician, the impact this can have on children in particular. particularly kids who are early in their life and their brains are still developing. We know that stress during this time can actually lead to changes in the brain that are life-lasting. A lot of the work that has shown that kids who have been exposed to some form of chronic stress or trauma early in their life can have changes that lead to suboptimal outcomes at every stage of their life. Increased risk for developmental problems, cognitive problems, and behavioral problems. As adolescents, increased risk for mental health conditions and adoption of health risk behaviors. And the average childhood experience study showed that even as adults, these individuals are at increased risk for both mental and behavioral health problems, but also physical health problems. Things like higher risk for hypertension, higher risk for cardiovascular disease, higher risk for cancers, emphysema, and the list goes on and on. And so these stressful conditions kids are particularly susceptible to these experiences. There's even data to suggest that there are alterations in in the molecular systems of kids that can be transmitted across generations to their offspring, and it can affect the health of the offspring, irrespective of their offspring's exposure to any chronic stressful condition. So what we're talking about here, right, is that kids who are exposed to these stresses, like this pandemic can be impacting not only their health, right, but the health of their children and their children's children, which really underscores the need for us to intervene, right, and to identify strategies that help to decrease family strain, particularly for kids and kids who are living in poverty and in communities of color.
All right, well, I think that's a good segue to Dr. George Johnson here, who is our licensed counselor and therapist. So hearing what you've heard, and there's some questions popping in the Q&A about stress and how to deal with it. You know, before we get into that, I know that there is often a disconnect between Black men and seeking support. George, can you speak to a little bit about that first, and then we can jump into maybe some strategies and ideas for people to keep themselves healthy at this time?
Yeah, definitely. You know, as was suggested and shared earlier, we've had lots of adversities that have been set up against us, and a lot of Black men are resistant or have been not willing to be open to their mental health struggles or just mental health in general. You know, even when I think about myself and my upbringing, I grew up in the church. It's still a big part of my life. But growing up, that it was to pray, or it was to keep it to yourself. It was to keep it within the family. Don't tell other people your business, because that's going to somehow negatively impact you. And as Black folks, as well as Black men in particular, we know that there's a history of research and other things that have been done that have been to our disadvantage, been to our death. So there's been a lot of lack of trust for systems or places where you can go and say that you're going to share without feeling that there's going to be some repercussion. But keeping that over time has actually led to a deficit where we've used other resources to deal with our mental health challenges. Sometimes those resources have been unhealthy. Sometimes just keeping it in. Sometimes that has added to increased hostility and anger, more alcohol and drug use. That sometimes is really a result of a need to deal with some of the mental health challenges, even as Dr. Wade was talking about some of the adverse childhood experiences that we might have had, or that abuse or assault, or just the unknown or overwhelmed or stress that you could be experiencing, where talking to someone could actually be helpful. And so the real big push is to push against the stigma that I've seen actually happen a lot more over my career. I've worked with a lot more Black men. I've worked with a lot more families of color of all different socioeconomic status, who are saying that they understand the benefit of having someone that they can talk to that might be able to help them to even just release or even to have some solutions. So even though there is stigma or has been stigma for years, my encouragement and support is to push against that, because if any time you need a release or need someone to talk to or need to bounce some ideas off of someone, now is a very essential time for that.
Yeah, thanks for that. And just, share with us, what are some of the things that you're seeing related to COVID, and how is your field addressing meeting the needs in this age of like social distancing?
Yeah, so I'm going to address that in two parts. I'm going to talk about the field in general. There's a lot of practitioners, clinicians who have moved their practice online to be able to work with clients virtually. Obviously, people would rather be in person, but there's still ways to work with folks. In particular, the place where I practice, Counsel for Relationships, one of the reasons why I've worked there for as many years as I have is that we're able to offer services from $5 to all the way up. So that means anyone or just about anyone can get services. And even if that $5 is too much, there are people who have been able to pay $2, right, to be able to come in and see somebody and get the mental health support and services that they need. And even recently, the organization has moved to try to find a way to support even those on the front lines who, once again, are exposed even more, which goes back to what Dr. Wade and Dr. Washington was saying, where there's increased stress and anxiety. And so to the second part of what you mentioned is that's part of what I've seen. A lot of folks feel like, oh, I'm not an anxious person. I've never felt anxiety. Well, if you've never felt anxiety before, you're feeling it now. You understand what it means to be nervous. Who can I be close to? Even family members, I don't really want to be too close because what if they have it? And if you have anxiety and you know you have it, it is off the charts right now. I know some people who they're so overwhelmed by anxiety, they can't get out of bed or out of the house or even to move around to even function, because anxiety can be so crippling that it just shuts you down if you allow it to take advantage. So some of the things I want for people to think about is know your triggers. Some of it is the news. Watching too much news or a lot of news, consuming that can be overwhelming and can shut you down. Or it could be the thought of losing money or that you've lost your job, that can be a trigger. Yeah, and so when you have these triggers, to know how to handle that, maybe to reduce the consumption, maybe to think about what other things you can do in terms of employment, or to figure out how you and your family can manage it. The other thing that I've been sharing with a lot of people is knowing who provides you balance. Now that could be your partner, your family member, that could be a friend, because a lot of this will have you out of balance, out of your routine, and you need to figure out what is the thing that's going to help you to get back into that routine or into balance. And so if you have been the person that hasn't thought that this is a big deal, you need someone to balance you out to remind you this is a big deal. Or if you're the person that is thinking that I need to pay attention to everything that's going on, you need someone that might balance you and say, like, maybe let's just hang out and have family time today. The last thing I'll say is that although there's a lot of loss, which brings up a lot of sadness and grief and pain for us, not being able to attend funerals, not being able to work as much, I've also seen people be able to take advantage of the opportunities and to be able, whether that means more family time, whether that means more cooked meals, whether that means sharing stories. These things help us in our own mental health, to see the opportunities, to find places where you can be grateful, and to be able to communicate that with those that you love and are connected to.
Thanks very much, Dr. James. And connected to that, first of all, there is some great resources being shared in the chat. One that was just mentioned was Black Men Heal. That's blackmenheal.org, which is offering free resources and access.
They're a great organization.
Counseling supportive services. Yeah, so
they've been doing a lot of great work in the city as well. Yes.
Thanks for sharing that. And again, I know the focus of this call is national, not just Philly, but we have a strong Philadelphia representation here. But, you know, again, we're all open as a resource to help connect you to things in your community as well. And Reverend Miles, so we know that, you know, family, community, and spiritual belief tend to be a great source of strength and support. And, you know, as a pastor, you are supporting lots of men's wellness efforts at Enon Tabernacle.
Absolutely.
One, just share some of the things that you're doing under normal circumstances, and again, how is that shifting now in the age of COVID?
Absolutely. Thank you. And again, I appreciate being here to be part of the conversation. I appreciate the brothers for sure. The church historically has been an anchor in our communities. So, of course, in times of crisis, in times of trauma, folk are leaning on their faith like never before. And for us, we thank God for that. And as a church, we want to be prepared to receive and meet the needs of those who are seeking answers, if you will. And so for us, especially as it relates to men, and I appreciate, Dwayne, you mentioning, for the most part, church is comprised of a lot of women, but men do go to church, bless God. Men are part of the mosque, bless God. And so for us, one of the things that we created years ago was a ministries around domestic violence, and we support our sisters 100%. But out of that conversation, we realized that men needed support as well, and not all men who are batterers, if you will, are evil, and they need support, and they need it as much as the women. So we created a ministry called My Brother's Keeper, which is an anger management ministry. You know, brothers would reach out to me and I would write a letter on behalf of them if it was court related, and the judges would not acknowledge or appreciate my input. Oftentimes, I guess they thought I would just give them 2 scriptures and say, call me in the morning, but that was not it at all. So I realized I had to go, and we, as a church, myself and a few other brothers, we got certified as anger management educators so that we can then support the men holistically around the issue of anger. And so if there were a need or a court-ordered need, we could meet with brothers, we could take them through a process of healing. And so what we're finding, even as a result of the virus and the social distancing, there is an uptick. We, of course, are supporting our sisters and making sure that they're safe, but we're also creating a context where brothers can reach out and get the support that they need. And so this group meets every Sunday morning, and they're continuing. They were meeting, and they're continuing now to meet via Zoom. So it's every morning, and we bless God. So just know that there's a place for men for an hour and a half every Sunday to come and share. So that's number one. And then number two, we're realizing just that the other ministries of the church. So feeding is one thing that churches, you know that to be true. And many churches do provide some food, but there's so many other things, especially the mental and the emotional support that we provide. So with, I mentioned domestic violence and my Brother's Keeper, but we also have a disability ministry, and we're making sure that they're okay. We're making sure we're providing PPE to their care attendants, something that's underserved. We're also making sure that our cancer support ministry has what they need, and if nothing more than just the socialization, that they can come together and feel supported in such a time as this. So we understand our role. We understand that your faith, people begin to question, and so for us, we're defining faith not rigid, but in a very broad sense. It's really what we believe about what we can't see. And so often, as a church, people are coming, they're asking, where's God in all of this? And we're trying to respond appropriately, and we're not over spiritualizing it. We understand that this is very real, this is very tangible, and folk need especially men, need very tangible support. If I answered your question, is there anything else, or if that's?
No, that's spot on. So thank you very much.
Thank you.
Yep. So one more question for you. So I know this past week, well, first I mentioned that in Philadelphia, there's evidence showing that those living in higher incomes were being tested at a rate 6 times greater than those in poor areas, even though Black people mostly do not live in these communities make up 54% of the deaths. Mm-hmm. So I know you had a testing that happened this past week. Can you talk about how that happened? Because one of the things that came out of a question earlier was around us taking care of each other. Yeah. And that if we know that there are these barriers that exist, historical and structural, and they're rooted in like racism and certainly not going to be seeking to advantage us, we have to do it for us. So, you know, in this case, you were able to connect with some folks who were talking about this in a very self-sufficient way. So,
absolutely. You know, again, it goes back to that church being the anchor. Testing was taking place on a very small scale within our communities. And so the Black Doctors Consortium reached out and asked if we could really support a screening event. Of course, the answer was yes. We put it out just a day before, and it was an overwhelming response. The testing was supposed to occur between 10 and 4 p.m. Folks were lined up at 7 a.m. Waiting, and by the time the 10 o'clock hour was upon us, there was a significant line, an overwhelming response. And unfortunately, because of the limited number of tests for our community, the screening could only last a few hours because really they ran out of tests. So there were a number of people on that day who wanted to get tested and could not. So there was a follow-up. There's been 3 other follow-up events, again, church and the mosque within our community. And again, it just speaks to the fact that if you connect with the right entity, you can then get the response that you want. So we screened, unfortunately, a third of the persons that received tests came back positive. Our senior pastor's been very open, so I'm not disclosing or violating, but he tested just to kind of demonstrate what the test looked like, and no symptoms, thought he wasn't exposed, only to find out that he tested positive as a result of. And so from that point on, he's been a cheerleader in every opportunity he gets. He just wants to speak to, again, the lack of equity in terms of screening and the increased need within our communities.
Yeah. So you were sharing a little bit about kind of the results that you saw just in the screening. And we did check with Dr. Wade to make sure we weren't violating any HIPAA rules, disclosing that. But yeah, can you just share what did you find once the testing was done?
Yeah, just over a third of the persons who screened were positive. So we were around 360 tests, and there was I think 128 tested positive. And again, think about it. They only went half the day. They didn't even screen as many folk that were there. Had they screened more, I'm sure that percentage either would have went up, or at the very least, we would have had a number of persons in our community who might not have known their status and would now know their status, would self-quarantine and follow all of the necessary protocols to help us flatten the curve.
Yeah, yeah. And just we, know that I showed some data earlier around Philly. There were, as of today, over 41,000 tests given, and close to 13,000 have come back positive. So, that's around a third of those cases of tests come back. So it's real. And I know that you are also experiencing, some positive within your church community with Reverend Wallace. So again, we're sending prayers his way, and
absolutely,
hope that he continues to stay healthy. Yeah.
Absolutely. Thank you.
Yeah. So there have been some questions in the chat. One was directed to Roy Wade, Dr. Wade, and I'm not sure if he can answer it properly, but it was around school starting. And I know Raynard Washington, who is, helping to lead his health department in North Carolina, may not have been able to stay on. I'm not sure if he's still on or not. But cool. So the question is around school reopening in the fall, and what's it going to take for that to happen?
Yeah, so I think there are a number of things, and Roy, feel free to jump in here, but from a public health perspective, we are looking at a number of key indicators to help us understand what's actually happening with our ability or our effectiveness to be able to sort of slow the spread of the virus. And I'll say that from an epi perspective, the same number of people might ultimately end up being infected, but we want them to be infected not all at the same time, right? So we need to slow the spread and obviously try to protect those who are at risk for severe complications and even death. So what we need to see is a decline in some of those key indicators. So our average percent positive over a certain period of time needs to start to decline consistently. We want to see a decline in the number of hospitalizations. We want to see a decline in the number of new cases. Obviously a decline in the number of deaths. And those kind of key indicators help us understand that we are headed in the right direction. I believe that, and I think everybody has accepted that we're going to really sort of be living in a new normal, even once stay-at-home orders start to be scaled back. I believe you probably have seen the guidance from the governor in Pennsylvania. There have been guidance from the governor here in North Carolina and really states across the country about how do we do this in a very smart way that does not make people, that does not sort of make all this for naught. Because if we just pull the Band-Aid off and let everybody go back out, then essentially we end up with that same level of spread that we would have expected if we had not done the stay-at-home order. So we have to really think about a phased approach where we start to gradually allow individuals to interact over the course of an extended period of time, unfortunately. I mean, and we're talking at least a couple of months. And then also ensure that there's still protections for those who are at the highest risk so that those individuals don't have severe illness or even death. So we think about these phases, and you might have to go to one phase and come back to that phase if we start to see things rapidly increasing or accelerating in a community. And that's really kind of the approach that you got to take on a hyper-local level, because even thinking about policies that might be implemented at the state level don't always apply to every county or city within a state. So really think about how do you build in triggers within that system to move individuals, move areas or regions areas along that sort of continuum of reopening. But on top of that, we'll still need to maintain some degree of social distancing for a very long time. I don't believe a long time. I don't know exactly how long. People keep saying exactly how long we have to do this, but it'll be for some time for sure, at least until we have the capacity to test as many people as we need to test, or there's a vaccine or a cure. I guess that could be possible. But in fact, we will need to maintain social distancing. So this whole notion of going to the grocery store, wearing cloth face coverings, keeping 6 feet away from everybody around you. Obviously, if you have symptoms, isolating and quarantining on your own, those practices will continue for quite some time. So what we mean by reopening really is starting to increase the number of businesses and the number of facilities that are available for people to utilize, but still those facilities will have to implement a number of control measures to reduce the spread or potential spread of illness in those facilities. So barbershops, hair salons, entertainment facilities, and then we'll also take a backwards progression in terms of gatherings. So you guys remember a couple of months ago, which might seem like it's been a long time ago, we started at, no gatherings over 100, then no gatherings over, 1,000, then 100, then 10, and in some cases 2 or 3, depending on the state. And so we'll need to go backwards, right? So we'll need to go from having no gatherings to 10 back to 50 and have appropriate triggers there to make sure that we're not spreading the virus. So it's not just about opening businesses, it's about sort of instituting those long-term measures that we'll need to have in place to keep those thresholds down to a reasonable level.
Okay, thanks. And I know there was another question that asked about environmental justice. And I know if Terry is still able to kind of chime in on this, but they're making the case for environmental and climate justice as it relates to COVID. And I know for me, it's not just COVID, again, like justice is this universal goal that we have, and climate is certainly one of them. Even looking at communities that are more susceptible to COVID, have all these other underlying issues. So it's lacking access to healthy food, it's lacking access to proper medical care, it has heightened environmental hazards and poor air quality, which result in heightened asthma in communities as well. Any thoughts in this kind of justice aspect and what we should be looking to build on in the future?
Well, we are so often playing catch up. We're always on the defensive. But I think at some point we need to start having these conversations among ourselves about how do we get ahead. And the topic of conversation really must be the causes of the causes. What are the systems and institutions and policies that put us in this position, and how can we bring about that fundamental change in those arenas?
That's real. Anyone else have anything to add to either of the questions that were posed in the chat? Cool. So the question to all of you is, what are you doing personally to keep yourselves healthy? And, what's your bit of advice that you have for folks who are joining us today?
Yeah, I'll start, and I guess I'll say two things: one about myself, and one about the community. Sort of what the appropriate response is to the disparities that we see. First, you got to do something other than watch the news. To do something other than come to work and stay here all day. But in addition to that, doing physical activity, going on runs and walks to sort of stay healthy. And most importantly, staying connected to people. It's so easy for us being isolated in our homes when we're isolated to disconnect from our family and friends as much as we can to keep in touch with them. And then more globally, I think in terms of our response to the disparities we're seeing in the Black community, just to sort of circle back to, engaging the trusted community leaders in our community has been a huge asset for really getting the word out. There's so much misinformation in the news, on the internet and everywhere else, that we got to get the correct and accurate information out to our communities, because there's the real potential to sort of have a huge negative impact on life and well-being if people don't have the right answers. They don't know where to go to get tested. The testing's not in their neighborhood, not accessible in their community, not accessible at their church. Then we lose a real opportunity, and we further fuel these disparities. So I think really targeting the community in a way in terms of information as well as access, and then lastly, making sure we're keeping track of those disparities. Dwayne, you mentioned early on that a lot of our states have not been reporting their rates or deaths by race. That's a really important aspect, and that's a policy change that's important, because if we can't monitor and detect the disparities, then we can't respond to it appropriately. So
I'll jump out there as well. For me, I've been trying to beat my kids in as many games of basketball as I can. We've been fortunate, and I also don't take it lightly, that I've been fortunate enough to play with my kids and to have opportunities to be around them, and that has helped me to be in a good mental state. I've also have tried to find ways to pivot my job. Not everybody can do that, but other people, if you have the opportunity, what are the skills that you can now use that might be virtual? If you were a tutor face-to-face, you could be a tutor online. And so I've been fortunate to do that in my line of work, and being able to encourage people to do that. I think at the heart of it is that I tend to work hard and long hours, and there are times where I didn't get to always see my kids go to bed. And so this has been a blessing for me in some ways, that I've been able to spend more time and to see them go to bed every night. And so as much as I can focus on that, there are a lot of hardships and disparities and challenges out there, but that helps me to go from one day to the next, is to see the opportunities, the advantages, the blessings that I have, and then I try to take that into the next day. So that's one of the ways that I try to maintain during this COVID.
Yeah. Thank you, Doc. And I'll jump in as well. One of the questions too on the chat I saw was how to engage men, and maybe we'll say Black men or men of color, around this issue. And so for me, all the things that were mentioned, I ditto, I echo. I think they're all important. And I'll just add, staying connected with one another. So connected to my folk from church, and connected to my frat brothers, connected to reaching out to friends whom I have not talked to in a while. I'm taking advantage of some of this time to stay connected, and really with brothers that lift me or encourage me. We have a text, a group text. I saw somebody, yo, A5, A right here. But we have a group text, and the text went out, said, hey, fellas, we're going to do push-ups tomorrow from sun up to sundown. I mean, those types of challenges. And I know my brothers, they'll just kind of keep sending, I'm at 200, I'm at 300, I'm at 500. We'll just do it. And it's just a way for us to stay connected, and really kind of every time you think about it, you just drop on the ground and do push-ups. But the push-ups aren't really, for me, the big deal. The bigger deal is staying connected to other brothers, and really reaching out to brothers and giving them permission. Hey, man. And usually people will hit me with and they'll begin the sentence with, or the text with, I know you're busy, but. And then my response is, no, what's up, bro? We're all busy, or we're all challenged around this time, but how can we support one another? Because I really want to create a context where brothers know it is okay to ask for help. In this moment, we're all bumping up against our mortality and our issues around safety and concern. And we are afraid even though we don't want to admit it, we're concerned to the point of being afraid, whether it's for ourselves or someone that we love. So reaching out and staying connected to other brothers is real important to me.
So I'll jump in following that. So yeah, I just want to echo all the different strategies that my fellow panelists have used. Exercising, connecting to family and friends, using social media in innovative ways to try to maintain connection. But I think as we think about communities of color, I think one strategy that we want to think about is how do we restore this sense of control and agency. I think the major stress of being a minority in this country is that you feel like you don't have control over your own body. And this COVID crisis has just magnified that, particularly as we look forward to the fall and maybe even the winter and the possibility of this pandemic still being with us. Like we don't have a sense of agency and control. And so, what are some ways that within your own community and with your own family that you can create that? To give you an example, here in my neighborhood, because we couldn't get our kids together frequently, we held a social distance dance party where we went and marked off 9 feet, markers up and down the street and allowed the kids to come out and just stand there as we played music and allowed them to dance. They couldn't touch each other, but they could call out to each other and see each other. And so what are some innovative ways that we can work in, particularly in communities of color, to restore that sense of control and agency? I think is key, because that goes a long ways towards decreasing the stress that people feel.
Can I just quickly address us? There was a comment or question about dating and sex, and we know people are still dating and people are still having sex. People are doing a whole bunch of things that they might need to kind of pause on. And I would just want to say, like, you got to be safe and to think about what is safe for you. I think if it's a new connection, that's a little bit harder, right? If it's somebody that you've already established some connection with before, you've had some time together, it might be a little bit easier. But once again, you put yourself at risk, and to be really mindful of judging between how lonely you feel versus putting yourself in a risky health situation. And, I was just talking about it today, like online dating or any type of dating is different now, but people are finding ways, double dates through virtual sites or through Zoom. You can be creative, as Dr. Wade was saying, to still connect with somebody, but it doesn't mean you have to put yourself in close contact or at risk.
Just one more point to that. There was another message in the chat, because we're all kind of sharing, more time with family and, friends, et cetera. But there are lots of folks who don't have those same, social connections, either single folks or people, who don't necessarily have the same supports. So do you have any advice or anything to share related to, someone in that situation?
Yeah, I responded to that person, but I'll say it out loud for everyone. There are a lot of people out there who are by themselves or feel single or feel more isolated than they ever have before because of the social distancing and not sure what to do. But there are ways, as Reverend Miles was saying, right, there are ways that you can be a part of groups. There are ways that you can touch base with folks. There are ways that you can still find ways to connect. I've seen people do virtual happy hours for ways to connect with folks, have competitions. There are multiple things that you can do, but I would say connect with your friends, coworkers, family members, even people maybe you haven't talked to in a long time. I heard recently that someone did like a high school reunion in a way that they haven't done in a long time. So there are ways that you can be social and connected without having to be in physical contact.
Yeah. Just one more. It's funny. So for me, I have a family here. So a lot of my time is spent making sure my teenage daughters are, good and having what they need, and the wife and everything. But I adopted a puppy. So he's a rescue, and my man gets me up at 6 a.m. every day, and it's about 8 walks a day, etc. I know there's a lot of need that still is being unmet. So perhaps that's one thing. Who else is able to share kind of how they're keeping healthy?
Wayne, I've been spending time doing some reading and writing and really hanging out with my wife, and I really love that. And I'm still working. So as part of work, I've been thinking about ways to message young people, particularly those people who are marginalized, those people who don't feel safe staying at home and find more comfort in hanging out with their friends on the street. And how do you talk to them about the COVID virus? And also at the same time, talk to them about hope, because there has to be a combination of those two things. You can't just tell people to stay at home and offer no hope in your language or images. So I've been doing the work in that area.
Thank you. Is that it? So one thing why we wanted to have this conversation tonight is that there are a lot of myths and bad information and sources that should be offering legitimate, advice and support at this time just, are failing us. So who are the trusted messengers? So we, wanted to convene as the Mayor's Commission on African American Males and Office of Black Male Engagement and the Center for Urban and Racial Equity, get some brothers who we know were trusted messengers in the community and had some things that possibly could be beneficial for other people to hear. So I just want to thank you all for your time and for joining us. I have a few things to share with you before we go. So one thing around keeping yourself safe, and again, you can't say it enough. So the practice of social distancing. So if you can stay home, please do. And when you do have to go out, please maintain that 6 foot distance, and also wear your mask. And even if you're trying to go grocery shopping, etc., do it at less busy times. Practicing good health habits, of course, washing your hands often with soap and water as much as possible. Covering your mouth and your nose and sneezing into your elbow is a practice. Staying home when you're not feeling well, that's really important as well. The other aspect is, again, looking out for others. While I'm walking the dog, I'm moving into the street. I'm trying to practice safe distancing as much as possible. I'm checking in on my neighbors and my relatives as much as possible. And then this notion of donating and volunteering your time. If you are able to, provide support in this time, I think there's plenty of need out there as well. Another thing is around what we can do and the whole issue around like individual versus like policy and systemic change. So, there was a question in the box about what do we do in terms of like, keeping this momentum and what's good for the whole community. So we're going to have another webinar next week. It's going to focus on incarcerated persons and the homeless population as well. But we need to advocate so that everyone is safe, particularly at this time, but always. So advocating for policies and care for incarcerated persons and for our immigrant populations. We have detainees right now being held in unsafe conditions. You have youth who are still being held in correctional facilities. They need to be somewhere safe. And if they are in, they need to get the proper care. Advocating for workers' rights, talking about essential personnel. And, we are now seeing grocery stores putting up protective glasses and, employees wearing masks and gloves and stuff. It took way too long for it to happen. These folks are putting themselves in harm's way to serve us. So how do we advocate for them so they can be paid properly, so that they can get sick leave? How about those in the gig economy who are delivering our food and still, taking us from place to place? How do we support them? Making sure our healthcare workers have the protection that they need in order to do their jobs and to stay healthy, putting themselves on the line every single day. We know we have the census coming up and it's online. We all should be, filling out the census. That's how we get representation. That's how we get funding and resources for our community. We know that the election is coming. We know that there's always some trickiness around it as well. We need to ensure that the election happens and happens in a fair way and that everyone has the right to vote, and we have to do it. We know that kids are learning right now virtually, making sure that everyone has laptops, everyone has access to school meals when they need them as well, all the resources and supports that they're supposed to have. Making sure that before we open up businesses, there is widespread testing. Before we decide that we're going to like open up schools, making sure we have the proper safety protocols in place. And again, you know, that's the only way we're going to be able to move on and get through this period. The other thing is around, you know, where the resources are available. So again, very Philly-centric in this way, but Philly.gov /COVID-19 has a ton of resources. What's happening in communities, where you can get things, etc. The Office of Black Male Engagement has their social media sites that are up and running with lots of good information. And of course, the Center for Urban and Racial Equity is also, you know, trying to push for fair policies for everyone. And we do have another webinar which is coming up again, and that information will be shared with you. So stay tuned. That's for the Mayor's Commission for African American Males, as well as for the Center for Urban and Racial Equity. So I just want to thank all of our panelists and thank you all for joining us. We want you to stay home, stay safe, and take care of yourselves. Thank you very much.